Jane had been having pain for about 2 weeks. We noticed it the day we were leaving for a spring break trip. We kind of watched it over the course of 2 weeks. She had some swelling on the right side of her neck.
We had a day planned of hiking and some different things. It was the Saturday before Easter, and she wasn't feeling well, so I sent her home.
I had felt something kind of like that before, when I was sick and had swollen lymph nodes or something like that.
Danielle went home and found her and said she's not looking real well, not doing well. I'm going to take her to urgent care.
After they examined my neck at urgent care, they sent us to the ER in Meridian, St. Luke's, just right across the street.
There was an obstruction near her windpipe that they were really worried about.
They told us she's going to need surgery today. She needs to be transported by ambulance downtown to St. Luke's Children's Hospital.
I met Dr. Jamie Price and Dr. Robison, and they were all so nice. They comforted me. They were like, it's going to be okay.
They were fully anticipating just having to drain a lymph node. That was something that was done all the time and no big deal, and that's what we were expecting.
She went into surgery and the wait began.
We waited there the better part of 3 hours and started to suspect that maybe he had run into something that he didn't anticipate.
He came out and sat down across from us and said she was just waking up and we could go see her soon. And then he said, unfortunately, I couldn't find any sign of infection. So my suspicion for cancer just went way up. And we were shocked. It was not something that we ever thought we would hear.
That night, I just remember I was laying in my bed and I was just listening to all the sounds in the hospital, and I just had a feeling that that's where I was going to be for a little bit, and I was just going to have to wait there.
We knew she wasn't feeling well. We didn't know what exactly her diagnosis would be. All I knew is I was coming to help her with coping through the first steps to figure out what we needed to do to help her.
On day 4 in the hospital, Dr. Jamie Price told us that the results were back and it was cancer, Hodgkin's lymphoma, stage 2.
I kind of expected that that's what it was going to be. So obviously I just burst into tears, but my parents just held my hand and they just told me that it was all going to be okay.
Jane would be needing chemotherapy to start, and more scans would tell us exactly the duration of the treatment.
They have to deal with the chemotherapy itself, so sometimes that requires coming into the hospital. We have to ask them to be very careful about exposure to infection. A lot of times they can't go to school as much as they were planning. They can't always be around their friends as much as they'd like. It's a really difficult thing that we ask them to go through.
I had to be admitted to the hospital. One of the worst chemotherapies was, they called it the Red Devil. It was just so nasty. It made me feel so sick to my stomach. I would get a couple hours of treatment every day, which was really hard. I would throw up. I wasn't able to eat except for Del Taco. I was able to eat Del Taco, which was really nice, and I still am. It didn't ruin it for me, so that's good.
Jane was in for a few months of struggle, at least. And it wasn't easy, but it was a lot easier knowing that we had so many good people behind us.
The staff at St. Luke's became our family. The doctors, the nurses, the child life specialists, every single person there made such a difference to our family. They all worked together so beautifully to just create a really, really wonderful experience for something that is so extremely difficult to go through.
Jane loved the child life services. They would come by multiple times per day, either with little crafts, with the tablet, movies. The dog would come by.
The coolest thing that recently came to be is our facility dog, Panther, who is trained specifically to go into procedures with our patients and help them cope in ways that humans just can't.
Panther came to the St. Luke's Cancer Institute. He had had the training at Canine Assistance. Working with him, they're taking him to hospitals, and they're doing bond-based training with him. There are so many different interventions he can provide. That's why he's with a clinical handler. That's why he's here every day. This integrative approach is still very, very important to their care. I think the donor support is key to getting our music therapy program started. It was part of our school teacher programs. I would not even have had the opportunity to learn about an animal-assisted therapy or facility dog. It always starts with the donor.
Without our community support, we just wouldn't be able to provide all the amazing services that we have. We're not billable services. We don't generate any money. We thrive on donation, and that's really how we can function to best serve our pediatric population.
There's a quote that I like: whether we know it or not, whether we like it or not, whether we're grateful or not, we are where we are because of others. I like that there are people that are kind enough to help the children that I take care of have better experience and better outcomes.
The future is so bright for Jane. She is so gung-ho already about just doing amazing work. She wants to be in the hospital more. She's already ready to volunteer in the junior volunteer program. I can just tell that someday she's going to be a doctor. She's wise beyond her years, and there's nothing that's going to hold her back.
She has a lot of goals. She's a determined kid. She'll do whatever she needs to accomplish those goals and to get what she wants out of life. And that's one of the things that helped her during her cancer journey, was that attitude of determination and optimism, and she'll do great things because of that.
What she went through, I don't think is a limitation, and I don't think she sees it as a limitation of any kind. I think she sees it as an opportunity for her to share what she has learned with others.
To someone who's going through it right now, as somebody who's in remission, I know that all the doctors there are the best people that could be helping them, and that they are being cared for in the best way possible, and that their family and their friends, and I love them and I'm supporting them.
It means the world, really, to anybody that has children at all, or especially sick children, knowing that there is a community of people willing to help with anything that they can, whether they've been through something like this or not. They're willing to help the kids, willing to help the science progress, help with the facilities. It really does mean the world. Every little thing in a situation like that counts for a lot.